Well, Ronan Lyons is Professor of Public Health at Swansea University. He also sits on the Wales Technical Advisory Group. Good afternoon.
Good afternoon, Oliver.
Some people are still in two minds about this. Is there any scientific evidence that these COVID passes, in the applications that they've been chosen for, will make a difference to infection rates?
Yes. So what we've seen earlier on in some large studied events such as Wimbledon, and if you remember the Euro Cup, particularly with England involved, we had quite a lot of infection from large-scale events such as those. And so essentially what's happening here is that rather than see that repeated, particularly in winter, in which infection rates are likely to go up, and there for a variety of reasons, the government is taking this action now to sort of try to stave off those things and prevent, if you like, further pressure on the NHS and on people developing long COVID.
I think the former Health Minister Vaughan Gething used the example this morning when asked about it of the infection rate at Green Man Festival, where a similar system was in place against some of the music events that were held in England without control, where there was a far higher level of infection. Is that a valid comparison?
I think, they're all a bit different. And so it's actually quite difficult to compare it one against the other. The other thing that many of these festivals, that they haven't been studied that much in depth. Essentially what you would need to do is to be able to, if you like, trace all of the people who were at the festivals and ensure everybody had testing before and testing afterwards. And that wasn't done in any of them. But nevertheless, there is a pattern appearing at which the more people who mix, the higher the infection rate, which is perfectly understandable given this is a highly infectious virus.
Do you think this policy is in any way applied, though, to encourage those who have not yet had the vaccine to get the vaccine, or is that just a byproduct? So, what's the primary reason for it? The primary reason is to keep spaces safe, or people get vaccinated so they can go to those spaces?
So vaccination isn't mandatory, and I think that's a good thing. The primary reason behind this one is to try to reduce the increase in infection, which is predicted to happen in the winter. Now, there's quite a lot of uncertainty over that, which is reflected in a report by the Academy of Medical Sciences a couple of months ago. You may have seen, so quite a bit of uncertainty. But we know that infections will increase in winter. We also have the problem of a whole pile of other respiratory diseases like flu and another virus called RSV on the scene. And we also know that the NHS is under considerable pressure. At the moment, there's about 600 beds occupied with people with COVID. And we also know that because of the pressures that we've been on for some time, there's a lot of delayed surgery and other treatments. So it's really important that we try to limit the damage that the virus will do in winter to the NHS to enable enough people to be treated and treated safely.
To hear the First Minister... I thought you finished. Go on.
Yeah, a byproduct of saying that, well, if you wish to enter nightclubs and some sporting events, there are two options, one being vaccinated, and for those who don't wish to be vaccinated, which should be a very small minority, they have the opportunity of having lateral flow tests within 48 hours. It may be that because of that, if people are going to events frequently, they may decide that they should be vaccinated. I mean, I have to say that I'm very much in support of vaccination, and it is something that I think almost everybody should have.
And the statement from the words from the First Minister today, that there'd be a consideration of rolling these vaccine passes out to enter care homes or hospitals if the situation were to get worse over the winter. And they will raise some eyebrows in places, because it's one thing, isn't it, to apply them to areas where you can make a choice. You don't have to go to the nightclub. You don't have to go to a rugby match. But in the case of going to a hospital or going to a care home, you have to go there under certain circumstances. And some people may choose not to go there because they don't wish to get a pass or unable to get a pass. That would seem to be a major departure from the situation and the application of the passes as we stand now.
Yes. So that is a possibility. I can understand why that might happen, and it depends on how the infections sort of pan out. So if we have a substantial increase, then additional measures would be needed. And you might say, well, okay, if you wanted to visit a loved person in hospital or in the care home, the last thing you would want to do is bring an infection in there, because those people are particularly vulnerable. We had a very high rate of death in our care homes last year. It was about 70% higher than it previously in other years due to COVID, and that's something nobody wishes to see again. The other thing about vulnerable people is as they get older, the vaccines don't work quite as well or for long enough, so there's a tendency to have vaccine waning, which is why we're undergoing, if you like, booster programs at the moment. So I think most people would be of the view that they would do everything they can to protect people who are vulnerable, particularly their loved ones in hospitals and in care homes. If it comes to that, and we don't know that it will come to that, and hopefully it won't.
Yeah, well, we'll cross that bridge if and when we get there, I guess. Thank you very much. Ronan Lyons on BBC Radio Wales.